My name is Ed Murphy and I'm the Senior Development Manager for Macmillan Cancer Support covering the south and west of England. 2 million people are currently living with and beyond cancer in the UK, and this is set to rise by 1 million every decade to 5 million by 2040. We know that after initial cancer treatment, many patients have unmet needs and are living with the consequences of their cancer and its treatment. Macmillan has been working with the Department of Health in England, the NHS, and along with other charities, organisations and patient groups for several years as part of the National Cancer Survivorship Initiative. In 2010, the National Cancer Survivorship Initiative developed a vision for care and support for people living with and beyond cancer, and in April this year published its guidance to support improving outcomes for people living with and beyond cancer. Key to this is that cancer patients should have a good experience of care which is of high quality and coordinated. They should be supported to live as healthy and active a life as possible for as long as possible. The emphasis is on supporting recovery, health and well-being after cancer treatment. A framework of care and support forms part of this, with 5 key stages to support people living with and beyond cancer, including carers. This involves a collaborative partnership with the patient and their health and social care professional, doctors, nurses, OTs, dietitians, physiotherapists and speech and language therapists, amongst others. The 5 key stages include Stage 1, information and support from the point of diagnosis. All patients should be offered a package of advice and support, information to support them to make decisions around optimal treatment and quality of life. All patients should have a holistic needs assessment to identify their needs near the start of their treatment, at the end of their treatment, or when their condition changes. They should also be given information on work and finance, and be signposted to support groups and other forms of support. Stage 2, promoting recovery. All patients should have access to and be informed of health and well-being events, supporting them to make the transition from treatment. This will help build confidence, knowledge, and increase their well-being, and should usually happen around discharge or instead of a discharge appointment. Patients should also receive a copy of their end of treatment summary, which will also go to their GP, and have a cancer care review undertaken by their GP or primary care professional. Stage 3, sustaining recovery. Not one size fits all. Patient care should be individualised. Patients should receive information about self-care and have access to or information relating to supportive self-management courses to help increase their confidence, understanding, and how they can take an active role in their care. They should also receive information and support with physical activity. Evidence shows that 2.5 hours of moderate intensity physical activity each week is shown to help with fatigue, stress, and weight issues. Patients should also be given further information on work and cancer and how to get back into the workforce if that's what they wish to do. It's important to note that 1 in 3 people in a study identified that they had a decrease in income due to their cancer and its treatment. The next stage is managing the consequences of treatment. We all know that cancer treatment may have short and long-term side effects, such as fatigue, pain, bowel and bladder problems. It's important to recognise and manage these to ensure quality of life and health of patients. And the last stage is supporting people with active and advanced disease. Again, assessment and care planning is key to this, and early detection of recurrence.